Welcome to Lynch Primary Care. Dr. Kendall Hare, Dr. Kevin Lynch, and we are coming today from the international headquarters of Lynch Primary Care in downtown Bel Air, Maryland, and wanted to address some of the questions that have popped up in the past few weeks regarding coronavirus. Most of you have likely received an email or 3 emails from us over the past 3 weeks giving some informational updates on coronavirus and COVID-19. And we thought we'd send out a little video clip responding to some of the newer questions that have popped up. And thanks for all of you for taking the time to send questions our way. Great questions, by the way. And there are 16 in all, so we'll try to keep our answers brief so this doesn't turn into a 2-hour video. But just before we get into the questions, I'm going to ask Dr. O'Hare just to give us an overview of where we're at with coronavirus today.
All right, so hi everybody. Thanks again for joining us and watching our video. So I just want to start off with the numbers, where we stand currently. So globally, as of today, there are about 2 million cases, active cases of coronavirus, and the fatality rate is around 130,000 globally. In the United States, active cases are around 610,000, and fatality rate numbers for the United States is around 26,000. For Maryland, we're sitting at about 10,000 active cases of coronavirus, and we've had about 349 deaths currently. And in Harford County, we have 152 active cases and 0 recorded of any deaths currently. So
kudos to Upper Chesapeake, by the way.
Yes.
That's phenomenal.
Done a great job. So just to put this in perspective, we've had this question a lot, is how is this different from flu, and why don't we freak out about flu as much as everybody is about the coronavirus? And just to give you some numbers, so from 2017 to 2018, the flu season, we had about 45 million people who got the flu. Of those, we had about 808,000 hospitalizations, and the fatality numbers for that was about 61,000. So just kind of think about that. We had 61,000 deaths of flu during the 2017-2018 season.
Which was a bad season, by the way.
It was one of the worst that we had.
Yeah.
And currently we're sitting at around 26,000 deaths in the United States alone from the coronavirus. So just kind of, put that in perspective. So being that coronavirus is new, what do we know about the coronavirus? Well, we know that it is more contagious. It's about 3 times more contagious than the regular flu. And unfortunately, it is more deadly. We are reporting about, in regular flu season, you'll have 1 death for every 1,000 cases of flu. And with the coronavirus, you're going to have about 20 deaths per 1,000 cases. We do know it's unpredictable, unfortunately, as well. It's affecting everybody, all ages. We do know that there's increased risk factors. So meaning if you are older age group, you're at a higher risk. Underlying lung disease, underlying heart disease. If you have autoimmune problems, you're more at risk. And also obesity, we know, is a risk factor. So the other common question we got are, what are the treatments? What are we doing to treat the coronavirus? And unfortunately, at this time, nothing has been 100% proven. There have been some studies, there's current studies going on, and some of the things that are currently being used is Plaquenil, also Plaquenil with azithromycin, the plasma transfusion with antibodies, and we'll talk about antibodies in a little bit, and also the use of zinc and quinine to improve your immune system. Do you want to add anything to the...
And there's a longer list out there on the internet, and unfortunately there's a lot of misinformation out there. And I will say that we will get to the Plaquenil, whether we would use it or not, so I'll hold my comments.
Okay. So kind of in summary is that the coronavirus is still mainly just a cold. It's a cold virus, just like you would get. And so 80% of us will just get a cold. Unfortunately, 15% will become hospitalized. And of the 15%, 5% will end up in the intensive care unit, on ventilator, respirator. And of that 5%, the statistics show about 30 to 60% will die from that. So That's the numbers.
Yeah, yeah.
Yeah. So that's just a little overview, and now I think we're going to get to more specific questions.
A lot of questions about vaccine came through. And so while I clearly don't have all the answers right now, vaccines are generally made by taking a piece of the cell. It's a protein on the cell wall typically, that is then infused into a human being, and they develop antibodies against that specific protein. And that's how vaccines generally work. There are, for example, there are flu vaccines out there that are called live attenuated vaccines that are partially destroyed viruses that are no longer can no longer harm an individual, but create a vigorous antibody response. So it's all about developing an antibody response against that virus. If you've seen pictures of the coronavirus, we all have at this point, there it looks like little pieces of broccoli sticking on the surface of the cell. Well, those are the proteins that the antibodies will attack. So it's that type of protein that we inject into somebody to develop an antibody response. Not sure when this is going to be available. You know, they're talking 12 to 18 months. I think that timeline is probably accurate. But who knows? Things may pop up that may make that a little bit sooner, may make it a little bit later. We don't know. And will it be a one and done vaccine, or will there be multiple vaccines that are needed over the years? We don't know. Nobody knows the answer to that.
Another great question. So, what I think they're referring to in the question when they use the term marker, we would use the term antibody. And the answer is yes, that once you have had the coronavirus, you should develop antibodies to the coronavirus, which should be there for a lifetime. This is one thing that we're hopeful for, that in the next month or two, we're hoping that they're going to roll out antibody testing, which will be a simple blood test like we would do here in the office, and we would be able to tell if you have had coronavirus and if you truly have the antibodies for it.
And there are some antibody tests that are even out there now for this, but they're not widely available. But
Right.
I do think your timeline is right. In the next 4 to 6 weeks, I think we will have things widely available for antibody testing.
Okay.
So COVID-19 versus the flu and symptom management. Just remember, with flu, there's specific antiviral therapy for that. So there's that. We don't have that for COVID-19. But for flu and flu-like illnesses in general, the recommendations are basically the same. And that is, number one, make sure you stay well hydrated. That's most important. Number two is get adequate rest. And then there's medication we use to manage symptoms, Tylenol and or Advil, for fever and muscle pains and headaches, decongestants like Sudafed, non-sedating antihistamines like Claritin, for people that have chest congestion, that are having a hard time getting phlegm up. Mucinex tends to be helpful, especially in high doses. And there's evidence out there that some of the zinc compounds like Cold Ease tends to, and actually this is in peer-reviewed, double-blind controlled study where they showed that Cold Ease actually shortened the severity and duration of cold symptoms. Now, is that going to be true for COVID-19? We don't know. Is that true for the flu? I don't know. But there's evidence that some of the zinc compounds tend to shorten the severity and duration of viral infections.
So, good question. And the bottom line is it okay to take Tylenol or Advil? Yes, for a fever whenever you have symptoms. In terms of at what specific temperature, unfortunately, there's no answer to that. It doesn't, there's no pinpoint number as to when you should definitely treat a fever. It's based on the patient, it's on a case by case basis, and it's really based on your symptoms. For example, if you're feeling so bad that you don't feel like you're getting hydrated, you're not eating, you just have such headache and muscle aches and pains that you're not staying hydrated, then take some Tylenol or Advil to help you feel better so that you can stay hydrated. So it's basically treating the symptoms, not so much treating the fever or a specific temperature number.
And right, and the important point, it's not curing anything, but
No.
if it helps you to feel better, it's probably worthwhile.
Correct. So what we do know is that the survival for your regular annual flu is about 99.9%, so pretty good survival rate. And the good news is, for what we know about COVID-19, for the general population, the survival rate is about 98%. So those are pretty good numbers.
So this outbreak is different from other outbreaks because it is more contagious than the flu and some of the flu-like illnesses that we've had over the years. It's more contagious, and it's definitely more deadly. It's about 20 times more or 30 times more deadly than the flu. And the importance of social distancing and changing our lives to more of a sequestered life, a stay-at-home type of arrangement, is to prevent from overwhelming the system. If we have 2 to 3% of the population, actually let me change that number to 5% of the population needing vents all at one time, we would absolutely overwhelm the system. And then you get into a situation like Italy had, which New York was fearing that they might get into, is where you're now having to decide who gets an ICU bed and who gets a vent. Very difficult thing to go through. So it's about, instead of, we know that there's going to be a spike in cases, and then there's going to be the downside to that. Things will lighten up a little bit, but we want to keep that spike as low as possible, because that's the danger with this virus is overwhelming the healthcare system. And we also know that every year, every other year, we get viruses that come through that just blanket the system. It seems like when people go back to school or when people get together for the holidays, there are viruses that just make the rounds, and it just seems like people have just blanketed the country with this virus. And it goes on for 2 or 3 or 4 months. But people aren't dying from it in general. And so it's okay to let those viruses go. This virus puts people in the hospital. This virus kills a lot of people. So this is one we need to minimize the impact as much as possible.
Unfortunately, we think that is definitely a probability that it will come back in the fall. And this is due to something that we call herd immunity, and there will be a lack of herd immunity. So what does herd immunity mean? So basically, herd immunity is when the majority of the population has been exposed, had a virus, and therefore have antibodies and are protected against it. And therefore, because 80% of the population is protected, that means that they help in an indirect way protect the other 20% of the population that is not. So while herd immunity usually takes a while, which is why we do think that it will probably come back in the fall. Would you agree with that?
Yeah, and so this is the downside of the social distancing, is that we don't develop adequate herd immunity. We have to do social distancing. There's no question about
Right.
that. But the negative is we won't have good countrywide, global herd immunity. And of course, that's where a vaccine will come into play.
Absolutely.
But one point to make about this resurgence of this in the fall, which I agree, I think that's a probability, we'll be better equipped to handle it.
Absolutely.
We will have the adequate equipment. We'll have a better understanding of this virus. We will be in much better shape when this next cycle comes through.
Absolutely.
I think the most important thing in terms of preventing infection is limiting your contacts. So limiting the people that are coming through your house. Now, what do we do about the grocery bags that we bring into the house? What do you do about the Amazon boxes that we bring into the house? People have different comfort levels with this. I don't think there's a lot of science that says you have to leave things sit for 3 days, or to bleach everything that comes through the house, comes into your house. Um, this boils down, I think, to common sense and personal preference. I don't think you have to bleach everything that comes in, but if somebody just dropped off a grocery bag outside your house and they were blowing and sneezing, I'd probably be a little careful about that, a little more careful. What are your thoughts?
Absolutely, I agree.
Yeah.
We're not taking
Yeah.
any extreme measures in our household. I have 3 children, so we're just making sure that we're washing our hands properly as well. Just normal, hygiene type of things as well.
And when you're coming back from grocery store or Home Depot or wherever, which we're doing limited trips to at this point, make sure you're washing up. So two different things. So the antibodies have been used for antibodies against specific diseases have been used for a long time, especially against certain viruses. And that's a treatment that's specific to that infection at that time. So that's an acute thing. That's not something that's a long-term thing. That takes care of an immediate need. So we are seeing antibodies used in the hospitals for people that have COVID-19 infection that are in bad shape, and they're using antibody infusions in certain cases. It is, and there has been FDA approval to use it in certain high-risk cases. And vaccine on the other, so that treats an immediate need, the acute illness, and then vaccines are used for longer term immunity against that virus. Vaccines do not help acutely. They don't do any good here and now.
So good question, because there's a lot on the news about losing your sense of smell, and the bottom line is not necessarily do you need to be overly concerned with the loss of your sense of smell, because you can lose your sense of smell for other things such as a common cold. We're in allergy season, that can also cause a lack of sense of smell. So while it's one of the symptoms for sure, but it can also be from other infections as well.
The stress from isolation that stemmed from the COVID-19 pandemic has been a common question, and several of you asked that question, and we did address this in an email in the past few weeks, and I'll just refer back to that just to remind folks that number one, I would avoid overwatching the news. The 24/7 news cycle will stress anybody out if you're just watching the news all the time. Get outside. Get some fresh air, focus on helping others, or doing some projects, or catching up on your reading, or writing letters. In other words, try to do something in a constructive way to occupy your time during the day. We all have projects to do of any variety. Try to maintain some form of exercise. Do your best to get 7 to 9 hours of sleep at night. That's important for your mental health. Try to stick to a generally healthy diet. When you're home all the time, it's easy to just pop in the kitchen and eat a few cookies. I'm guilty of that myself, and you just gotta control it. Keep in touch with family and friends and neighbors while maintaining social distance, of course. And if you're getting in trouble, call us. Give us a call. We can help. Consider adjusting medications for a few months. Sometimes that helps, or consider starting medication even for a few months. But that's something done with our input. Any other thoughts?
I would just add, trying to stick as much to a routine as possible.
Yes.
Still going to bed at the same time, still getting up at the same time. And having a daily routine will help, deal with this as well.
So hydroxychloroquine, or Plequenil, as is the easier name to say, has been shown in some very small studies to help people recover faster from coronavirus. Now, these are small studies, and remember, 98% of people recover from this virus without having anything but supportive care. for 80% it's just a cold. So the people in the small study that recovered from hydroxychloroquine, was that a result of hydroxychloroquine, or were they going to get better anyway? We don't know. It looks like in some small studies that it's probably better than placebo. I think it's a fairly innocuous medication for short-term therapy. So yes, I have prescribed it in one patient so far who was getting in trouble with COVID-19. And on day 4, we started him on Plaquenil and azithromycin based on those small studies and based with the understanding that we don't know for sure if this works or not, but it's a reasonable thing to try. It's probably not going to hurt, and it may help. That was we approached it that way.
So good question. So first of all, Ebola, it's good to know that it was first documented, outbreak was in actually 1976. So it's been around for a while. Most of us remember the most recent infection outbreak, which was in 2014 to 2016 in West Africa. And it is different from COVID in several ways. One is that people know immediately when they are symptomatic because the symptoms are very specific and they are very severe. I'm talking about Ebola here. So, and you are also not contagious until you are showing symptoms. Versus COVID, we know you can have been contagious and spreading it without even knowing it because you may not have symptoms. The other difference is Ebola is not easily transmittable. It's done through bodily fluids. So that is your sweat, that is through blood, that is through urine, versus the coronavirus is spread through particles. Someone sneezing, coughing, leaving the germs, either directly on you or on something that they've touched. So in those cases, that's the way that Ebola is different than COVID.
And the big difference here is the fatality rate from Ebola is 50%, as opposed to COVID, it's in the 2 to 3% range.
Correct.
To sterilize, cloth masks have become fairly popular, and sterilizing them, soap and water does the trick. You don't need to. One of the patients asked, "Should I boil the cloth mask to sterilize it?" You could, but just running through the laundry cycle, soap and water will sterilize it.
Another great question, especially being that we are in springtime and we are seeing a lot of allergies. So just to kind of break it down in terms of, allergy symptoms. First and foremost, majority of times if you've had allergies, you've had these symptoms before, so they should be somewhat familiar to you. In addition, they typically are sneezing, runny nose. A lot of times you're going to have a postnasal drip, which sometimes is going to leave you with a sore throat. Definitely some coughing, again, because you have the postnasal drip, and also some itchiness. Notice I did not say fever. I did not say shortness of breath. Those are two kind of things that are a little different. So with the COVID-19, you are going to expect to have fever for sure, cough, shortness of breath, fatigue, the loss of appetite. So those, to me, the fever, shortness of breath, are kind of two ways to differentiate. And
so on a personal basis, I was working in the yard last week, and I started sneezing and blowing and hacking, thinking, okay, I got it. I've got coronavirus. But it was all better in a couple hours, so I'm pretty sure I did not have coronavirus. That's my usual seasonal allergies. But it does scare you at this time, with what's floating around in the world. Whether to go into the emergency room or not based on symptoms is always a tough call. The big triggers for this, shortness of breath is a definite. If you have shortness of breath, it's time to go into the hospital. And many of you have obtained pulse oximeters, those little things you stick on your finger to see what your oxygen level is. And if your pulse ox is dropped down to 90 or below, it's time to go in. If you're developing confusion, having trouble focusing your thoughts, or getting disoriented, another trigger. And I would say the other one is unable to maintain adequate hydration. Staying adequately hydrated with an illness is a key factor to recovery. And if you can't maintain hydration, it's time to go in the hospital. But a lot of gray zone here, so if you're not sure, call us. We will do our best to guide you through.
Absolutely.
We did have a late entry question that came in this morning. And the suggestion was, or the question was, could we permanently change the manner in which Upper Chesapeake and other hospitals function, in that could we have separate emergency entrances and areas for people that have evidence of some type of infectious process? And that makes a lot of sense. And I will pass this recommendation along to the powers that be at the local hospital. Great idea for longer term isolation of people with viral illnesses. Makes a lot of sense, especially in the coming year or two.
Yeah, great idea.
And then what are our opinions as to how we can possibly truly open back up to what we consider normalcy unless we are all tested? Another good point, the test availability is ramping up. I'm pretty confident in the next month or two we will have adequate testing for everybody. We still don't at this point. But once we have adequate testing, both for do you have the virus now or have you had the virus, the antibody test. Once those two things are readily available, we'll be able to have a much better handle on allowing people to congregate or to care for people in a nursing home or to go back to school and back to work, etc. So testing is a key part. You've heard this, I'm sure, from the news outlets, and it's coming, and I'm confident we'll have something fairly soon. I think that wraps up our question and answer session. I just wanted to thank all of you who sent questions in, much appreciated. Some general recommendations. One is make sure you stay informed, but not 24/7. Take news breaks. Secondly, get outside occasionally. Thirdly, minimize your trips to the grocery store and Home Depot, etc. Stay in touch with family and friends as much as possible. Beware of scammers. There are many out there that are that want you to donate or want you to buy something, that want your personal information. Do not give out personal information over the internet or over the phone unless you are 100% sure who you're speaking with, okay, or who you're communicating with online. Also be aware of misinformation. There is lots of misinformation going on around there. The news outlets don't always have it right. The media tends to exaggerate things. And let me once again emphasize what Dr. O'Hare said earlier, and that is that the survival rate to this terrible coronavirus, and it is a terrible virus, but the survival rate is in the 98% range. So now, if you're in the 80 plus population, that survival rate is not in the 98% range, but in the general population, it is 98%. And remember that this too will end. We are right at the peak of this at this time. And I think in the next week or two, and the pundits are saying the same thing, that we're going to see the numbers start to decline a little bit, at least reach a plateau before it declines. And also remember that the two of us, and our practice is here for you. If you have questions, if you need help, reach out to us. That's what we're here for. And lastly, stay safe, stay tuned, and please let us know what you thought about the video. We'd appreciate your feedback. Thank you.
Thank you, guys.